partly sunny, nice day for tomorrow, the high near 80. A mostly sunny day Friday with a high near 83. I'm Steve Williams on AM 560, The Answer.
It's currently 59 degrees. Your next news update in 30 minutes. Continuous coverage of news, traffic, and weather at 560theanswer.com. I'm Elisa Z. Chicago's Morning Answer Show continues on AM 560, The Answer.
This hourly segment is brought to you by Papa Nicholas Coffee. Papa Nicholas Coffee, a family tradition since 1897.
This is Chicago's Morning Answer with Dan Proft and Amy Jacobson on AM 560. The Answer.
Top of the morning, Dan and Amy, and in for Amy this morning is Scott the Cow Guy Shalady, Fox Business regular.
Good morning.
There it is. Chewing his cud over there.
Well, all four stomachs.
President Trump's COVID briefing yesterday evening, he provided some data. And boy, I wish I like these sort of refurbished versions of the COVID briefing where it's just Trump, it's prepared remarks, it's data intensive, trying to provide some context that the media will not with respect to COVID. It's much more productive and, frankly, presidential. On cases nationwide, they're declining. You wouldn't know it, but they are. Here's President Trump explaining.
As of yesterday, cases are declining in 70% of the jurisdictions compared to 36% last Monday. That's a big, big number. 11 out of 13 states with the positive rate above 10% have seen a decline in daily cases since mid-July. In other states, the data suggests that the need for continuing vigilance always is strong, even though the numbers are getting very good. States that have a test positivity rate between 5 and 10%, and in the states with the lowest positivity rates, we also see slight increases in daily cases, and a couple of them. We must ensure that these states do not become new flare-ups, so we're watching them very, very closely.
And on fatalities, again, the data.
Fatalities nationwide are at roughly half the level of the April peak. So the number of deaths or fatalities are at half the level. One is too much, one death, because this should have never happened to us. It should have been stopped very easily by China in Wuhan. Thanks to our major advances in treatment, we've seen vast improvements in recovery rates across all age groups. Compared to April, mortality rates are 85% lower among individuals aged 18 to 69 and 70% lower among individuals over 70 years old. We've also made significant strides in sheltering those at highest risk, especially the elderly. Approximately 85% of all current cases are individuals under the age of 65. Just getting some very accurate numbers on this. And these are people who are generally at a much lower risk of complications. Since the pandemic began, nearly half of all fatalities have been at nursing homes or assisted living centers. That's an incredible statistic when you hear that number.
Would you think that the fatality rate is half of what it was at the peak in April based on the news coverage you get? Based on the, I want to teach, but I want to live too sort of rhetoric you're getting from teachers' unions
Unbelievable.
Around the country, for example, amplified by the press corps? I mean, that's the data. It is not in controversy.
And the problem is we keep trying to fight the fight with data, and it doesn't matter anymore because it's about your feelings.
I know.
And that's a huge, look, and a lot of some of these legislators will point to Europe and say how much worse we are doing than Europe. Well, if you take the Western countries of Europe, Belgium, France, Italy, Spain, and Germany, that combined population is roughly the same as the U.S., 335 million. We're doing much better. Now, as a group, for sure, Germany is doing a little bit better than us as deaths per 100,000, but still, we're doing much better. But you know what? We can't talk about those things. First of all, it's good news, and that doesn't sell newspapers and or ad space. But this is how they want to keep control. They want to keep people afraid. And
more context too. Again, 63% of counties in the United States have fewer than 5 COVID deaths. Nearly 2/3 of counties in this country. Every place is not New York. And in point of fact, as we know, New York, New Jersey, and Massachusetts, 10% of the population, nearly half of all the deaths. It's concentrated. This is not to be flippant about those deaths. It's not to be flippant about the virus. It's not to be unserious about it. It's to provide context so the response is proportional, because I would argue the response has not been proportional. And for those advocating lockdowns, well, you can do what you want at the state level, but you're not going to get air cover from Trump.
An extended lockdown would fail to target resources at the highest risk populations while inflicting massive economic pain, long-lasting damage on society and public health as a whole. So there won't be lockdowns, but we watch specific areas. We're very careful.
For more on this, we're pleased to be joined by Alex Berezow again. He is the Vice President of Scientific Communications at the American Council on Science and Health, a PhD microbiologist, as well as a columnist for USA Today. Alex, thanks for joining us again. Appreciate it.
Hey, thanks for having me on.
So why don't we begin with schools, since that's top of mind for, 50 million families around the country. Again, I'll just ask you the question we've asked all the medical experts that we have on. Is there any argument against, precautions included, kids being in the classroom to learn in 3 weeks?
I think that it's a tough argument to keep schools closed because of the damage that we're inflicting on kids. Because if kids that are 5, 6, 7, 8 years old, they need contact with other kids. This is what they really need for their own social development, their own educational development, their own mental development. And I think we have to look at that. There was this piece in Esquire magazine that this author said that, he was essentially, we have to make life or death decisions about sending our kids back to school. And it's such a silly thing to say. This is real. I looked up these statistics. So far in the 5 to 14 age demographic, so that is basically kindergarten to 8th grade, there have been 19 COVID deaths among kids. 19, okay? Now, among that same age demographic, a couple of years ago, 2018, there were over almost 300 homicides. Okay, so there were. So you're roughly about 15 times likelier if you're a kid 5 to 14 years old to be murdered than to die of COVID. And so, you have to put these things into perspective. And no, I very strongly advocate going back to school with precautions. If there are teachers who are afraid, maybe we can make some sort of accommodations for them in some way. They teach from home or something. I don't know, but school needs to happen.
What about larger society? What is your perspective on the lockdown whack-a-mole that's being played in states and big cities in particular around the country? There's a growing body of evidence that suggests lockdowns actually exacerbate the spread because most of the transmission occurs in households.
Well, I don't know about that. I'm still here in Europe. I'm actually coming home next week back to Seattle, and I've been in Poland for the past 6 months. So I'm looking up these statistics. So in Germany, yesterday, August 4th, there were 8 deaths from COVID-19. Same day in the United States, there were 1,265. So the United States didn't get it under control. Trump's statistics to me sound a little bit like, polishing a turd, right? I mean, it's not great news, but he's going to try to spin it to be good news. Compared to Europe, the United States is an absolute mess. And so...
I just want to hold you there because I want to include this. And Tony Fauci, because this is the Dems line, Why didn't we control the virus the way that Europe did, as if they did it so unequivocally well? Tony Fauci's explanation is, well, they shut down their economies like 90%. We only shut down our economy like 50%. That was essentially his explanation. But there's a couple of things there. One is shutting down our economy more than it was shut down. Was the damage severe enough for the level of shutdown that we did inflict on ourselves? Number two, yeah, there's something different about America than those other countries that America is being compared to. Our federalist system, decentralized government, that's something we used to cherish. And now we're supposed to scrap our entire system and go to some command control system like a socialist European country to combat a virus when we've never done this before. And we've had viruses that have taken out hundreds of thousands of people in this country before, particularly if you prorated per capita, like comparing what happened in 57 or what happened in 68 to what's happening now.
Yeah, there's definitely some major differences between European countries and the United States. Germany does have a federal system like the United States does, but they were much more coordinated under Angela Merkel. But the other European countries definitely are more statist, right? The government can say you're going to do this, and then people do it, and that's never been the case in the United States, right? So you have to tailor policies that make sense to your that make sense culturally, right? And I actually wrote an article about that as well. That there are certain the running of the bulls, right, in Spain. Like, that's got to be like one of the world's dumbest traditions, right? Let a bunch of bulls out and they'll run over people. Okay, they're never going to stop doing that, right? Because they like it and it's their culture. And so, when we a total lockdown, telling Americans you can't go anywhere and you can't do anything, it was never going to be a good policy to begin with, because it would not have worked in America. So I do agree to that extent that it was a policy not fit for the American culture.
Well, and there's also this, just going back to what I said at the outset. Again, New York, New Jersey, Massachusetts, 10% of the population, nearly half the deaths, more than half the deaths, as President Trump mentioned, in nursing homes. So, the idea that this was done so badly, well, if it was done so badly, look at the resources at the federal level that were scrambled for New York and New Jersey in particular, and California too, but New York and New Jersey in particular, where it did spiral out of control. And so I'm sorry, that's the entirety of the country's fault? What Andrew Cuomo and some governors decided to do in terms of reintroducing infected patients into nursing homes? I don't think so. And I don't think that every hamlet and county and state has handled this badly. And it's a little bit annoying, frankly, that everybody has to be lumped in with the aggregate stats that are being driven by a handful of states.
I agree with that, and the corollary to that is that large policies don't make sense when applied, equally across the whole country. It does not make sense to apply the same policy in New York City as it does to, Peoria, right? It simply doesn't make any sense. And so I do think that the United States erred in that regard. In Washington State, they were putting small towns under the same sort of restrictions that Seattle was under, and it absolutely did not make any sense.
Alex, Scott Schulte here. Question, where do you stand on lockdowns? Having seen what you've written and your experience over there in Europe, I've got a British passport myself, but what do you think about those countries and what they did, and do they work, or are you a fan or not?
Well, I'm not a fan. It's sort of like saying, are you a fan of colonoscopies? No. Right? I'm not a fan of lockdowns, but I think that they worked. They certainly worked here in Europe. But then here's the thing. After lockdown was finished, people were then forced to wear masks. And that's still the case in Poland. If you go somewhere and you're in a public indoor place, you have to wear a mask. You get fined if you don't. So, and the cases here have been relatively under control. So I think that as much as I hated it, and as much as I really was angry by it, in retrospect, it looks like it worked. And so, I hate to poo-poo something if it worked. I mean, I wish they would have had a better policy. And probably from now on, if there's another flare-up, we'll know that there's better ways to do it than a total lockdown, right? We can say, okay, no more sporting events, no more mass gatherings, everybody's going to wear a mask. And we wouldn't have to do this total lockdown again because we have a better idea how the virus spreads.
Before we let you go, I wanted to get to this other piece that you wrote, because you've tackled another area of science that's important. We had Michael Schellenberger on the program to talk about his new book, Apocalypse Never, and to talk about this remarkable mea culpa that he issued for what he termed were his contributions to climate change alarmism over the decades, as somebody who's got a 30-year record of being an environmental activist. And he is now being pilloried, of course, by the apocalyptic climate change crowd, including the scientific community. And he's even being called, remarkably, a white supremacist because he won't abide their AOC-like predictions about the world's end.
It's crazy. And there's this theory known as critical race theory. And basically it's a derivative of Marxism. So under Marxism, the Marxist thought is that there's this hierarchy of oppression with rich people at the top, the elites, and everybody else at the bottom. And they're being oppressed by the people at the top. This is why Marxists always favor revolution, because they say the whole system's broken, has to be overthrown. Well, that's now been replaced by race. And the people at the top now are white males, and everybody else is at the bottom. And therefore, if you support anything in our society, if you support the status quo in any way, you are, by definition, supporting white supremacy. You're probably a white supremacist yourself. And that is what Mike Schellenberger was called, because he thinks climate change is not something we need to be panicking over. It's simply a tackleable problem. It's a problem we can fix. And therefore, he is supporting the current status quo. He's not supporting revolution and turning over everything. Therefore, he's white supremacist. That it sounds nuts, and it is nuts. But this theory is gaining traction on academic campuses all across the country.
Oh yeah, and this will be right back center square when the COVID-19 pandemic subsides, sometime in 2050 or whenever that happens.
Of course.
And by the way, I mean, this is permeating everywhere. I mean, your home state of Washington and Seattle, where you're heading back to, right? I mean, they're in the K through 12 system. They have math is racist. Traditional math is racist. I had this conversation with James Lindsay from New Discourses on my syndicated show last evening. He's literally in a discussion on Twitter that people should read, where he's arguing back and forth with Nicole Hannah-Jones, the founder of the 1619 Project, Pulitzer Prize winner, about 2 + 2 = 4, and whether it just equals 4, or it can also equal 5 based on the terminology that you're using to set up the equation. There's a racial component to 2 + 2 = 4.
This is exactly correct. This is what is going on. It is a combination of postmodernism and epistemological relativism combined with this ridiculous view of race and racism that is essentially saying that there's no such thing as knowledge, that all knowledge is in itself a power structure and is racist. I'm a scientist, as you guys know, and I have heard arguments that science itself is racist.
Yeah.
So there's nothing, literally nothing is sacred. Nothing is free from this poison.
By the way, epistemological relativism was the name of my high school garage
spell
band.
It too, right?
Yeah.
You know what?
Crowded house cover band.
I don't think this talk will carry on, throughout the rest of the country and the world. But I tell you, my gut instinct is, and it's worth nothing, but this line of thought will not win. It will not last. It won't. It's a fad. These types of thoughts are fad. Now we have to pay attention to them and make sure that we've corralled some of these ideas. But at the end of the day, I don't believe that America has had 100% of their common sense wiped from their brains and to let something like this fester. It will fester on the sides like other things have in the past and also subsided. I mean, like eugenics. But I don't think it won't. This will not win the day.
More like the French Revolution. That went away too, but there was some damage left in its wake. Yeah, I'm sorry, Alex. Go ahead.
But my concern though is how many people are going to have their lives destroyed and careers ruined because of this.
True.
Because how many sensible professors will be chased out of academia because of this nonsense, and academia will go even further left than it already is.
Do you know how far left it is? I mean, I think the numbers are, say, in the 1960s, it was 2 liberal professors for every 1 conservative, and then slowly but surely to 1990, it got to be, say, 4 to 1, and then 2008 to 1.
It's about 10. It's about.
They say it's over 40 now.
10 to 0.
Yeah, well,
now absolutely.
But it's amazing what's actually happening. I mean, in front of our very eyes, and this is where all the this trade schools come in.
Alex Berezow, Vice President of Scientific Communications at the American Council on Science and Health, PhD microbiologist and columnist for USA Today. Alex, thanks for joining us again. Safe travels back to Washington, and then safe living in Seattle.
Right. If it's still there when you get there.
Yeah.
Thanks, Alex.
My pleasure, guys.
Thank you. Take care. You join us on the Turnkey.pro answer line.
The more you listen, the more you'll know. This is Chicago's Morning Answer. Morning Answer on AM 560. The Answer.
Balance of Nature, changing the world one life at a time.
I've been on this balance of nature for quite some time now. I know that what you put in your body is critical to your health. I listen to AM radio